Welcome to Grit City Tales, the podcast brought to you by the Humane Society for Tacoma and Pierce County. I'm Mary.
And I'm Maggie.
And together we're amplifying the untold stories of pets and the people who love them right from the heart of Pierce County, Washington. Thanks for joining us.
Thank you so much, everyone. We are going to talk about the importance of vaccines for pets today, and to help us, give us all the knowledge is one of our veterinarians here at the shelter, Dr. Kat, or Dr. Kat Spaulding is the official name. We call her Dr. Kat around here. And so, Dr. Kat, before we dive into all the nuggets of wisdom that you're going to share with us, can you tell us a little bit about yourself? Tell our listeners what an amazing person you are.
Yeah, hi, I'm Dr. Kat. I have been here at the shelter since March of last year. So I've been here almost 2 years now, and I was relief here before that. I am a 2021 K-State grad. So if there's any Wildcats out there, what's up?
A little plug.
I have always been a shelter veterinarian, high volume spay neuter focused. So I'm very passionate about access for care, and making sure that we have people here for our community that can help serve all the pets in this area. Before here, I worked at Northwest Spay and Neuter Center, so I'm very familiar with the community and have been kind of all around doing all the things, including vaccine clinics for
us here.
And here, helped launch that here, which has been a huge success, and we've seen tons and tons of pets, so come see us.
Yeah, I think our goal was 600 for the year's pets served, and we've already reached that goal in July.
Yeah.
So we are definitely, the need is there. So I'm glad that we're able to serve the community in this capacity.
Yeah, so now we get to dive in on why those vaccines are so important, why we vaccinate pets here, the frequency, just all kinds of details that could help you make decisions for your own pets.
So we want to talk about, essentially, when we have animals that are brought into us, what vaccinations are given upon intake, and why are those so crucial to give before the pets get put in their kennels?
Yeah, so our focus here is obviously kind of herd health, since we have so many animals here. So as soon as the animals come in, they all receive kind of what we consider to be the most important vaccines. So all of the dogs receive a distemper parvo vaccine. That's a 4-way vaccine that covers a few different viruses. And then they also get the Bordetella vaccine, which covers kennel cough, because that's the most common thing we see when you put lots of animals in a small space, kind of like daycare.
Yeah.
Where everybody gets sick. And
spreads like wildfire.
Any of you parents, I'm sure, are very familiar with that, or terrified of the upcoming school year for all the ickies that are going to come your way.
Yeah, and then cats are the same way. They just don't get kennel cough, so they get their core vaccine, which is, the acronym is FVRCP. It's also a vaccine that covers multiple different viruses, but it's a respiratory / cat version of parvo, which we call Pan-Luc.
Well, that's extremely important, because the last thing we need is a bunch of sick animals all in one area. And so there are cases in which animals come in and they are already sick, such as parvo. We have gotten a lot of parvovirus cases. Is there a story that you can recall, handling one of those emergent cases that come in? Because it's handled very differently than a dog that's brought in apparently healthy.
Yeah, absolutely. Parvo, unfortunately, can happen to any animal that's under 1 year of age, but it is more common in an animal that hasn't received a vaccine yet. So the guys that are in that 6, 8, 12-week mark are the most likely to potentially come down with it. It's present in the environment. It's highly contagious. So it is really important that they get vaccinated to try to give them their best chance to not get it. Mm-hmm. Sadly, there are some that come to the shelter and they already have it. The best one I can think of happened probably 6 months ago. Really, really cute chocolate lab came in just as a stray, no background information or anything. He got his intake, went into a receiving kennel just like anybody else. A few hours after that, one of the staff members noticed he had really, really bad diarrhea in the kennel that was bloody and kind of had the classic, what we call the parvo look and smell, which is as gross as you think it would be. And so right away they alerted vet staff. It's a pretty easy, quick test. We just have to take a small sample and then run it through a little test that snaps down, and we just wait and it tells us if it's positive. This dog was positive. He was interesting because he wasn't super young. We aged him at about 8 months based on his kind of teeth and size. So older than you would expect, which I thought was interesting. Of course, too, because he couldn't have come in at like 9 a.m. when we had all the time in the world. He came in at 7 p.m.
Of course.
And so most of vet staff was about to head out, myself and the technician who was with me included. And then it became all hands on deck to get him treated. So, of course, then he got moved right into vet. We got a catheter put into him, an IV catheter, started running fluids. He was super, super dehydrated, really nauseous, really just didn't feel good.
And he was found in the woods, correct?
Yeah, he was. I think animal control actually had gotten a call that he was out there, and they brought him in. So we ended up later naming him Timber because he got found in the woods.
We're so creative around here.
Yeah, we think we're clever. But yeah, it became all hands on deck. We have a full protocol that we usually put in place for these guys. And the most important thing is just trying to get them rehydrated, because vomiting and diarrhea leads to dehydration, just like people and dogs, really quickly. So bolus lots of fluids, injectable anti-nausea meds, antibiotics for any secondary infection. These are really intensive. They're really hands-on.
What's the survival rate? I mean, I've heard it's pretty low, actually.
Yeah, it's better than it used to be. I would say in the last 10 years it has gotten better. The earlier you can catch it, the better, the higher it is. I think it's still considered to be 50-50 for the ones that are caught relatively early. Even it's still not super good. The later it probably drops to 70% don't make it, 30% do, or maybe even a touch lower. But if you can catch it early, it can be very treatable, but you do have to get pretty aggressive pretty quickly, because these guys get dehydrated and they tank really fast.
Really fast. Within 24 hours.
And especially the puppies, I mean, thankfully he was a bigger, older dog, but the puppies, when they stop eating, then things like their blood glucose and things like that really start to tank too, and then that puts them in a really critical position, which is why they once they start becoming symptomatic, they're on a really short timeline.
Wow.
Well, and you had mentioned that, in the last 10 years or so, things have improved. I remember you saying that Timber actually got a treatment that is relatively new here for animals that come to the shelter. Can you explain a little bit about that?
Yeah. In the last, I want to say that drug came out about 8 months to a year ago. It probably really started to be available on the market. And we're lucky enough to have the resources to have a small amount of that in stock. So this treatment is a monoclonal antibody injection. So it's the first of its kind to actually be a treatment for parvo itself. It actually works on attacking the virus and working at the level of the antibodies, versus all of the other treatment previously was just symptomatic supportive care. And then they have to fight it on their own. Yeah, exactly. So
and
this is the
babies.
First one. Yeah, they
can't fight those things.
Yeah, so this is the first thing that really targets as an actual treatment rather than just a supportive care. So it's really cool. It is an expensive treatment. But at
least it exists. We realize
first of its kind, and
a lot of treatments aren't available to people, both for human healthcare and for animal healthcare at this point. But it's nice to know that at least something exists. But an easy way for it to be kind of prevented, that's a pretty tried and true way to keep your pets from, if they do get exposed to it, at least to keep them from having the worst symptoms, are vaccines like the DA2PP that you were saying that all dogs get upon arrival. Can you go into more of that and the frequency at which, all of us here have dogs. Sure, many, if not all of you listening have dogs. What can we do for our own pets?
Yeah, that's the good news, is a lot of this is fairly preventable. The vaccines aren't a for sure 100% your dog won't get it or your cat won't get parvo or panleuk, but it does significantly decrease their risk. But it is really important that the vaccine series has to go all the way through, and you do have to do all of them. It's not, sadly, just a one-stop shop for all of them. But yeah, so most people start their first vaccine. They consider it like their puppy shot or their kitten shots at around the 8-week mark.
Mm-hmm.
So most people will do 8 weeks, followed up by another booster shot at 12 weeks, followed by a third vaccine at 16 weeks. But just because you don't start at 8 weeks, if you adopt your friend or whatever at, let's say, 10 weeks, perfect, you start at 10 weeks, and then you do one at 14 weeks, and then you do an 18 weeks. Most of them have to be a 2 to 3 vaccine series, depending on when you started, but they just need to continue to get vaccinated every 3 to 4 weeks until they're 4 months of age, so until they hit that 16-week mark. And that's the same for dogs and cats.
What if you get an adult pet?
Yeah, good question. So adult pets work similar, but they're a little simpler. So at any time they can get their first, if you're not sure if your pet's ever been vaccinated, we just say assume they haven't. So they get that very first vaccine. They can get it at any time, and then 3 to 4 weeks later they need a booster vaccine, and then that is good for a year.
Okay.
So adults are a little bit easier. That's for cats and dogs. So they just need one and then a booster, and then every year after that they just need a following booster 1 year later. It's just a
yearly
one yearly, and then they're good to go.
Wow. Yeah, thank you for sharing that. I know booster schedules are scary for some people.
Yeah.
It's like, oh my gosh, I just want to get it done. Well, the first step is always
just
the
start
hardest.
them. Yeah. Just go in, whether it's our monthly vaccine clinic or there are a lot of mobile vaccine clinics in the area as well, like hosted at Tractor Supply stores, pet supply like places, Good Neighbor Vet, things like that. There are at least a lot. It seems like now a lot of options, so people don't have to wait to get into their regular vet for an appointment who might be booked up. They're like walk-in or weekend vaccine clinics. Yeah,
absolutely. I used to recommend to people all the time, life gets busy. The 3 to 4 weeks is hard to remember. Put it in your phone, put it in your calendar so it pings you when they're due, and then that way you can't forget. It's just 3, and then once you're done. So
yeah, and then those like yearly.
Yeah, and then I always just put in a yearly reminder. I just set it to auto do every year.
Do you give your own pets vaccinations?
My own pets.
Yeah.
Yes, because it's easy to do everybody else's in the world and forget that my own little furry friends also need their vaccines, because if you preach it, you should probably do it. So,
well, do you want to share? I want to talk about cats and stuff as well, but let's hear a little bit about your own furry critters.
Oh my gosh, I got the cutest little bunch. So I have one dog. She's the best dog in the whole world. Her name's Riley, and she is a pit bull Australian Shepherd mix. She's the goodest.
Can confirm. Have met Riley.
Can confirm.
Yes,
she's amazing. Anyone who meets her loves her. She looks like a tortie cat in a dog body.
Yeah, I guess I didn't think about that. But
yeah, she does. Yeah, she's weird. But she's awesome. And then she has her own little pack of cats that follow her around. So then my husband and I have 3 cats. We have Bender, Nacho, and Spades, who are just all little monsters, anywhere between 5 and 7 years old. And then Riley's about to turn 4. So.
Wow.
Yeah.
I feel like 4 is a good number. That's what I have too. 4 is a good number. Good. Maggie is a little.
Hey,
she's on the dramatic
4
side.
4 dogs. So that's like normal for animal welfare people.
A dog, and a dog's a dog.
Yeah, my one dog would have been fine with no more, but that's okay. And then I have my 3 rabbits. So and then I foster things. Rabbits. So
I know. Yeah. See, my house is open to a foster because Riley's incredibly dog social. So then I take dogs home on the side.
You see,
take work home with me. Yeah.
So vaccines are super important
vaccines
in your household.
Get vaccinated. Yeah.
So that leads us. I mean, we can talk about cats now too.
I want to follow up with Timber, because we talked about the treatment that Timber got and how long that took. I want to know what the end result was.
Yeah, of course. Yeah, thankfully we got aggressive. We did all the things. Timber did make it. It took several weeks, so he probably took a week of pretty intensive therapy. Probably at about day 4 to 5, we took his IV catheter out and were able to kind of switch him to orals as he started to begin to eat again, but not without the help of anti-nausea, antibiotics, appetite stimulants, all the things. But he did start to turn around, ate again. There is a little bit of a quarantine time where they're still, even once they're not symptomatic, they are still contagious, so they do have to stay in our parvo isolation until they clear from that. he actually went to foster in the meantime because we had somebody who was kind enough to step up to take him. And then he came back through and got his neuter and got his booster eventually. Even timber. And then and then he went to the adoption floor and
was adopted by
got scooped right up because he's
very handsome.
Him's a very handsome boy.
Yeah.
Yeah, their new adopters said that Cooper has been the most loving and playful dog since we brought him home. He's my absolute baby, and I wouldn't trade him for the world. And I love a happy ending.
Love it. Yes, thankfully he was. I wish I could say every single one that we've done has been a happy ending. I do think the ones that we've done the monoclonal antibodies on in the last 6 months, we have probably seen a better success rate.
Mm-hmm.
But we do get everything from super, super severe to early onset parvo, and that makes a huge difference.
I mean, I will say that our shelter is not the best setup for doing intensive care, as I'm sure you can
You can attest to that, right?
Yeah.
And
I'm
there
always
are a lot of
impressed by what we
animals.
get done.
I am so impressed by what the vet team gets done in the small space. I mean, I call the surgery suite a little, like, hole.
It is. The closet.
It's a closet.
It is.
And y'all get so much done.
Yeah, our ISO spaces are limited, so sadly our capacity to take these on isn't too high, but we don't usually get too many at one time, knock on wood. But
don't you do that now, Dr. Cat.
Normally not too bad, so we can usually have one at any given time
where we can dedicate
a lot of time.
Mm-hmm.
Yeah.
Well, kittens are another story, though. It seems like when those pan-luke cases come in, they come in droves, and that is really tough and sad too. Can you talk more about the kitten side of all of this?
Yeah, the kittens are often a little trickier. I do see that we get a lot of them when they're younger, so that makes it tough. A lot of times the whole litter is impacted, which not that the dogs aren't, but it does seem like the cats are more of whole litters being impacted. A lot of times we don't get them until they're pretty far gone, or some in the litter have already started to pass away. We did have a case not too long ago where we pretty much had that exact same scenario. I don't remember if it was a litter of 4 or 5, but all of them had passed away. And then we had one that just seemed to
One little fighter
that seemed to have just maybe enough antibodies for mom to try to stick with us. And we had actually one of our foster leads took on all the really intensive supportive care to turn this little kitten around, and every other kitten in the litter died except for this one. And she the vet staff got her all set up. We got all the initial things done. She took over, did a lot of extra care because we're not 24 hours. And when they're that tiny, I mean, they have to eat pretty regularly. They need fluids pretty regularly. So without a dedicated foster, it is really tough to turn those little guys around.
Our foster families really save lives. Period.
Yeah.
Period.
Yeah.
Well, and there's not a similar like the monoclonal antibody for cats, is there?
No, that is a dog specific treatment. So we'll hope that one day. Yeah. Hopefully it's on the horizon. I would hope that they can use some of that research to try to move that into cats. But yeah, that is a dog specific treatment at this time. So it's specifically for the parvovirus. In dogs, but their cats are still at that stage of supportive care and a prayer.
Yeah,
literally.
Well, it's more prevalent in the warmer months, I heard, because it lives in the soil, right? Something like it's like
it's in the environment.
Yeah.
So the warmer months, especially, I mean, when the ground's not cold and everything, when the rain's coming in and all of that stuff, and it's past fecal oral. So if you can be asymptomatic and have it, and so if they're chomping through an area where there's some kind of like fecal debris, and then they drink water, or they're digging in the dirt, or they're doing gross dog things and they're putting things in their mouth because they don't know, it can really happen. That's why it is really important not to take puppies to public areas like dog parks. Even being really careful around your neighborhood is important until they start to get some of those vaccines, which I know is really tough for people because they want to take their cute puppy to the dog park so bad.
As do the public and we see their cute puppies.
But it is so important for them to
get protected first.
Then go. They got their whole lives to go out and play and see everybody and get socialized. It is really it's worth it to wait until they've got at least that first and second booster kind of on board, and they're at that 3 to 4 month mark before you start taking them, especially to a high traffic place like a dog park or anything like that.
I'm seeing in my head puddles and mud and
they're puppies. They put everything in their mouth. They just don't know.
Rolling in the puddles and drinking it. Oh,
yeah. So
I was like,
even around your neighborhood, I mean, just because you don't see them, there's tons of dogs walking around. There's tons of just standing water and all the things. It's never worth the risk because it's super preventable. And if they do get it, it can be very expensive, and even if you throw everything at them, they can't die, and it's never worth it.
Well, it's heartbreaking, and I know you see a lot of these cases, and you know, we try to save them all, but
absolutely. And a lot of these are our members from the public that brings these animals, and they don't know necessarily that it has parvo, or they are suspicious, or
even just people finding the stray kittens that
just finding them, then they're sick, and they bring them here, and sometimes we're able to do our best, and sometimes we can't. But yeah, it's always heartbreaking for everybody involved when one comes in. Honestly, whether it has a good outcome or a bad outcome, because
it's still an intensive
very
case
sad, and they're very
they're
guarded,
mopey, and they
just look sad.
Yeah. Well, and so we've talked about the importance of those initial vaccines for your pets, the FVRCP, the DA2PP.
We didn't go into what FVRCP covers.
The FVRCP, it's a weird acronym, but it stands for feline, viral, rhinotracheitis, calicivirus, panleukopenia. So the last three of that, the R, the C, and the P, those are what it covers, those three different viruses. And then the distemper parvo one in dogs is really similar. It's the D's for distemper, A's for adenovirus, P is for parvo, and then parvovirus and parainfluenza. It's DAPPV.
And so what we've been talking about the last few minutes is the panleukopenia and the parvovirus.
Correct. Yeah. So they're one component of both of those two. They do cover other things.
Do we see those as often?
We don't see them as often. We do see calicivirus quite a bit in some of the kittens. And I would say we see distemper not super often, but it is highly contagious and a nasty one. So that's probably the other most common one, and parainfluenza, but it's often hard to differentiate that from kennel cough.
Okay. And can you describe what kennel cough is for those that don't know it?
Yeah, sure. So kennel cough is if you ever have to take your dog to a groomer or a doggy daycare or like the kennel or anything like that for boarding, they're often going to require this one just because you've got a lot of dogs in a tight space. The Bordetella, it's the name of the pathogen, so that one's bacterial, but it passes through like nose-to-nose aerosol contact, so that's why when you put lots of them in a small space, that's why we say like, oh, it's like kids at daycare. It is. It's dogs that are barking, sneezing, getting exciting, sharing water, all the things. They're more likely to pass it, so that's why you're going to find that you have to do those for those kinds of places. That vaccine is considered situational, so it depends on your lifestyle, but I do highly recommend it if you think any of those things are going to be in your future or things you might do. And that's also why obviously here all the animals all of the dogs get that on intake, because they are going to be in kennels with other dogs, and they're going to be passing other dogs and using play yards that other dogs are in and all the things. So it doesn't necessarily prevent it from happening, but it can absolutely lessen the symptoms, and it can prevent it. It can help them build up some immunity.
More protection.
So, absolutely.
Yeah. And so with the kennel cough vaccination, is it a booster schedule as well?
Yeah, so it's an interesting one. There's actually 3 different kinds. There's an oral one, there's an intranasal one, so it goes in the nose, and then there's an injectable one. The one that goes in the mouth, the oral and the intranasal, those ones are one and done. They don't have to be boosted again until a year, so they don't need that kind of in a few weeks booster. Every now and then you'll find a place that requires it every 6 months, just because they see a lot of a high volume of dogs, so they'll recommend it a little more often. The only one that would need to be boosted for any reason is the injectable. It's the least common. Not a lot of places do that one, but if you did that one by chance, that one is on the same. In 3 to 4 weeks, it would need 1 booster, and then it's good for a year.
Yeah,
we use the intranasal or the oral one for our vaccine clinics.
Yeah, we use the oral one.
Okay. So if you were to come visit us, you'd only have to come once for that one until
just
a
one
year's
time.
passed.
Yes.
I would say spraying something up an unknown dog's nose is very difficult. So
Yes, it is the least liked. You'd think it's the pokes. It's absolutely not. If you have the
right by the-
intranasal one, that is the one they hate the most. You will fight them every time. Yeah. Oral, not as hard, not as bad.
Well, because you're already putting parental in there.
Yeah.
So,
They're all right with it.
which is the dewormer. So we talked about the most common FERCP, DA2PP. I want to go into rabies vaccinations
Yeah.
because every animal, every cat, every dog, every ferret.
All the ferrets.
Even horses. I saw a post on a vet that I follow that was talking about a rabies case for a bat in Thurston County, and so they were advising to get your horses rabies vaccinated.
So why do we get our
Yeah,
animals
so
rabies
dive into that.
Yeah, rabies is a weird one. It's one of the vaccines that is required by state law. So that one is it is required. It's not an optional one. It's not very common. It is kind of one of those ones
Here in
where
Washington, at
they're
least.
yeah. And in most places, maybe third world countries not so much. Most of the states are pretty not rabies free, but rabies minimal.
Yeah, rabies minimal. I
Rabies
like it.
minimal. But yeah, things like bats are the number one carrier, although there are quite a bit of wildlife that can carry it too. So you do have to be careful, and that's why it is required, because an animal that gets rabies, there is no treatment for it. So it is considered to be 100% fatal. And then it's considered state law because in people, it can be passed to people as well. And if a person becomes symptomatic, it's 100% fatal in people as well. So it is taken extremely seriously. That's why if you ever were to have like a wild incident where you have a bat in your house and you wake up and you see a bat, they recommend you go get post-treatment. They actually recommend you go get like prophylactic therapy treatment.
Whoa.
And that's a series of
because
shots, I think, for us humans.
Yeah, it is. You actually have to have the whole series pre done to be a veterinarian, because you're just such at high risk because you're touching so many animals. So
You
like,
had to get
I'm
it done.
rabies vaccinated.
You've
Yeah.
been rabies
Look at you.
vaccinated.
Yeah. A lot of, and a few of the staff members down there are rabies vaccinated because of that reason.
Because we have risk. You have risk of bites from unknown animals.
vaccination status, correct? Because a lot of these animals are strays. Nothing known about them.
No
so
known vaccine history.
if
We
you-
rarely get vaccine histories.
yeah, very few. Every now and then I own a surrender, but that's about it. But yeah, so it is taken very seriously because of the potential risk to people, and the very high fatality rate if an animal does come down with it. So, but there's a lot of places that, because of the rabies vaccine is a great example, because a lot of places have become truly rabies free. Hawaii is a state that's rabies free. They're very proud of that. That's why if you ever need to take your animal there, you have to have lots of proof.
Oh yes,
Of
my
rabies.
sister-in-law and brother-in-law
Yes.
just moved there with their
Yes.
cat and dog, but it's not impossible.
They do take their rabies status free status very seriously, and you have to have a lot of proof that they've been on a consistent vaccine schedule.
And so when you do get the rabies vaccination, you get a certificate of vaccination from the veterinarian that administered the vaccine.
Correct.
So that's something that a lot of places require.
Yes.
So we offer the rabies vaccination at our vaccine wellness clinic. So please come get it.
Yes. It's another one and done too. No booster. It's just do it one time, good for a year. And then if you get it done again 1 year from that original date, the next one's good for 3 years. So there's a good payout if you can stay on top of it. Put it in your phone. Put it in your calendar. Because if you're late by 1 day because it's state regulated, then the next one can only be a 1 year.
I didn't know that.
They're very strict on it. But then the stuff builds up, so then you get 3 years out of it. And yeah, there's only one other vaccine. We don't do it here, but it's one that I highly recommend in Washington. It's the lepto vaccine. We actually don't carry that one, but leptospirosis is the only other one that I highly recommend. I do it for my own pet. Washington is a super high lepto state because it's transmitted through water most commonly, and we love the rain. So that one's a really important one. That one's one that the original one does require a booster, and then it's good for a year every time. They get really sick if they get lepto. It's really gnarly. And I've known a few friends that have had animals, or have had cases of animals that have died from it, because it it has a very like non-specific presentation, and so often by the time you figured out that it's lepto, it is difficult to diagnose. Because it doesn't really look like anything specific necessarily, kind of has vague symptoms. So that's another one I highly recommend. There's a lot of places locally that do it. Almost all your general practices are going to do it. And even a lot of the low-cost places will offer it too. So that's a really, really good one. It is important to booster it. If you don't do that booster, then the vaccine's useless. But
right.
Yeah.
And so what I'm hearing is that all of these things are preventable, and get your vaccines.
Yeah.
Period.
Do it. Come see us. Come to the vaccine
or see
clinic.
anyone,
or anywhere.
You can actually some of the vaccines you can buy at your local like farm and feed store if you're comfortable or trained to administer the vaccines. So if you're looking in that direction, I mean, the rabies has to be given by a veterinarian.
Correct, because it's state law. That is the only one that's not an option for. But there's definitely a lot of people that will kind of get them started until they can get in somewhere, or people have a medical background, things like that. But if you're uncomfortable for any reason, just come have somewhere do it for you. Pay for convenience. Yeah,
and you don't have to have a veterinarian exam to get vaccinations, correct? So it's like a once-over to make sure that the animal is just healthy, presenting well enough to get a vaccine.
Sure. Okay. Yeah, absolutely. So definitely check them to make sure they're not looking sick for any reason, but no big intensive exam required or anything like that. If you're getting established with a local clinic to use as your regular veterinarian, they're going to want to do an exam for sure, just to establish you as a patient. But lots of vaccine clinics will you can come in, takes like 10 minutes, get it done, and then
that's what I've done.
Then all done.
Because I have 4 dogs, so bringing them all at once to like my normal vet, it's kind of an ordeal.
It's an ordeal.
Bringing them anywhere all at once is an ordeal. But because of the low-cost local clinics, I can bring all 4 at once, get them all the vaccines, and I don't have to pay an exam fee for each dog as well. Yeah. So I personally have utilized those, and it's great. And then obviously if you adopt an animal from us here, that already comes with your new pet having all those vaccines.
Yeah. I wanted to ask about vaccine reactions because I have had a cat react to a vaccination. We couldn't narrow down which vaccination it was because he got the FERCP and the rabies that day. But he had a reaction such as like swelling and restlessness. And I just was hoping that, what are some common reactions to vaccines, and when should you take your pet to your veterinarian after receiving a vaccine? Yeah,
for sure. That's a really good question. So normally, most of the vaccines are really safe. I would say in all of the vaccines I've given, which has been probably hundreds, I've seen 3 vaccine reaction animals, separate animals, in the last 2 to 3 years.
Hundreds?
Thousands. I was going to say,
thousands.
You've done 100 just this week.
Thousands. I've seen probably like literally a handful. So they are pretty uncommon, but I usually do recommend if your pet's getting vaccines, if you can hang with them for at least a couple hours, that's definitely ideal. If you can hang with them for the rest of the day, that's ideal. Most all of them get kind of just like kids, they get kind of the, I don't feel super good. They might be a little dumpy for the rest of the day. That's no big deal. That spot where they got it might get a little sore. But usually that's no big deal. Every now and then we get one that does have a little bit more of a reaction. So the most common things we see is swelling. So that usually presents as facial swelling, which sounds odd. It's not like the vaccine goes anywhere near their face, but their face swells. And it can look like red and irritated and puffy. They kind of look like they got stung by a bee. That I would definitely have them seen for usually as something as simple as like some kind of an injectable steroid or injectable, it's basically like injectable Benadryl, can be really helpful. Like, don't recommend you give your pet over-the-counter anything because you can do a lot of damage if you don't know the ingredients in them. So I do recommend call wherever, any place you get that done. They're going to give you advice on it. So if you're worried about it, but that's usually a pretty mild vaccine reaction. The other things you'd be looking for is like vomiting and diarrhea. If that's probably the next most common. If that happens and doesn't start to resolve within 24 hours, I would absolutely have them seen. Or if it's like blowout severe, they can't hold anything down, they're looking really dumpy and lethargic, that would be a reason to definitely call your vet back or whoever did it and have them be seen.
Yeah, absolutely. What's your definition of dumpy?
Dumpy. My definition of dumpy is just looking pathetic. Sad, pathetic, moping around. You know, they're usually that high energy, happy puppy.
Lethargic.
And now they're they don't really want to play. They just kind of want to lay there. That's really normal. Especially in some of the little guys, the smaller they are, the harder it kind of seems to be on them. But that usually resolves by the next morning. They're usually their wild, happy, playful selves. They're wanting to eat and all the things. Yeah. That's super normal. Facial swelling, vomiting, diarrhea. That's probably reasons I would give your vet a call. But super uncommon, and usually super treatable. Resolves on its own. You might just need a little extra something, but.
I feel like I'm getting free vet advice since my cat was the one
You're
that...
welcome.
I mean, his little tiny face was just so swollen.
Yeah, facial swelling is definitely the most
too.
common.
Like, It was scary.
It can look really pronounced, and so if you see that, I always recommend call. The couple of times that happened, though that was a symptom I saw as well. I only had one that presented with that and the vomiting diarrhea. It kind of had the triple combo, but. Yeah, facial swelling.
Trifecta. Sadness.
Yeah, facial swelling, most common, resolves on its own, get some meds. It usually resolves in 24 hours or so.
Yeah, and that was the case for both times that he reacted to it.
And then if your pet ever has one, I always just recommend, it's not a reason to not do the vaccines. There's a lot of ways you can mitigate that. So often, if your pet does have a vaccine reaction, just make sure anytime you're taking it in for a vaccine, just let them know so you can do some preemptive stuff. So we just give Benadryl injection basically ahead of time, wait 30 minutes, then give it, and then usually have you wait around for a little bit of time.
That's really good to know. Thank you.
Yeah.
I'm nervous.
Definitely let them know that it's had one in the past. You can let them know if you're not sure which ones. You can tell them which ones they had that day. But any animal who's had a vaccine reaction in the past, I would always just preemptively do them. And then you would definitely want to, don't try not to schedule too much that day so that you can hang with them. So that if anything were to happen, you're right there and can take them somewhere.
Yeah, totally.
Luckily, I mean, for anyone listening, like Dr. Kat said, only a handful of reactions she's seen.
It's very
none of
rare.
my animals have ever had problems. I've been really fortunate,
But Hiccup has had all the problems.
Yeah, her cat, Mary's cat has like a plethora of things, so it makes sense that he would, of course, have vaccine reactions.
It's definitely good to know about. It does happen. Most places will walk you through that. But if you ever have any questions, just ask the veterinarian who's on. They can tell you all the things to look out for.
Yeah, and the vet was even willing to hold him for the rest of the day and make sure he's okay. And so
100%.
Yeah, it was a scary but good experience. I'm glad I reached out and didn't think I was crazy.
Yeah, don't Dr. Google it. Just call.
Yeah,
Don't do it. You'll be scared.
Well, we've talked about all the regular vaccinations that pets receive here at the shelter. We've talked about vaccine reactions. Thank you for all your doctor advice.
Yeah, you're welcome.
We got Dr. Kat, not Dr. Google here.
Yeah, Dr. Kat.
When people ask me about vaccine advice, I'm going to send them this podcast.
That's right.
I'm giving you.
That's right. Here you go.
This little nugget of knowledge.
Free vet advice. You're welcome.
Free vet advice. And so, I really appreciate you coming on and taking time out of your busy schedule to chat with us in the community about vaccines. Dr. Kat talked earlier about barriers to access to care, and especially veterinary care in Tacoma. We have a plan to help that by getting a mobile veterinary unit, which Dr. Bennett spoke about a few podcasts ago, and so we're really excited to be able to go into the communities instead of asking the community to come to us, because that is a barrier, and so we're really looking forward to having another tool in our toolbox, essentially.
Yeah, I think it'll be really great. Like I said, I've gone to mobile clinics myself, so the fact that we'll be able to offer that for the community is really exciting.
Yeah, and I'm hopeful that we'll be able to help more people where they're at, meeting people where they're at. So, well, Dr. Kat, thank you so much for joining us.
Yes, thank you.
You're welcome. It was fun.
Yeah, you got coffee.
Guys are fun.
Everything was good.
There was coffee.
Oh, we're fun.
I feel like I learned so much, and I've been in this field for a long time, and so I really appreciate you coming and talking with us.
Of course.
If you enjoyed this episode and you'd like to support the podcast, please go ahead and subscribe. Share it with others, leave a rating and a review, and if you have any questions that you want us to answer on a future episode, go to our website at thehumanesociety.org/podcast and submit your questions. To catch all the latest from the Humane Society for Tacoma and Pierce County, check us out on Instagram and Facebook at Tacoma Humane.
See you next time.
Later.